I set up this hub just over a year ago, probably about 18 months now, actually, with some really good support from Can Digital. And we set the hub up as a place where those of us working in public health communications can come together, share best practice, share examples of things that have worked, campaigns, solve problems together, and also to learn from each other. So just a little bit about me and my background. So I've worked in the NHS in South East London for more than 24 years now. I'm currently working part-time as Head of Communications, Engagement and Behaviour Change for NHS South East London, ICB. And in the past few years, I've become a bit of a specialist in running behavioural science-led public health campaigns, where we've been able to see real and positive outcomes for people's health. And through those, I've won several awards and really kind of developed my passion and my knowledge in that area. So I currently split my time between that NHS role and also supporting and training other public sector colleagues to run behaviour change campaigns. So before we get going, I'd just like to introduce our other speakers. So Alison, would you like to introduce yourself?
Hello, I'm Alison Whittaker-Stewart. I work for Together in Active Future, which is one of Sport England's place-based partners.
Thanks, Alison. And Peter?
Yeah, good afternoon, everyone. I'm Pete. I'm the activation manager for the We Are Undefeatable campaign. So I'll talk a little bit more to that when we get started shortly.
Brilliant. Thanks, Peter. And John Paul?
Hello, I'm John Paul from Can, and we help lots of different public sector organisations amplify various campaigns that deliver measurable outcomes.
Thanks, John Paul. So just before we get going with the real stuff, I just want to introduce it a little bit. And I'm really excited about this topic. We've covered a lot of different topics, and this is the first time that we've covered physical activity. And personally, I'm passionate about the role that we as public health communicators can play in prevention. And prevention itself is, I think, more and more important than it's ever been, particularly as, the health and care systems are, facing the financial challenges and cuts that, we were anyway, but have been announced in the last week or so. Although it is challenging, I do think, we have a really important role in continuing to kind of support the prevention agenda, and we can actually drive some of it as public health communicators. The impact that exercise could have on so many different health problems, including, arthritis, risk of dementia, risk of diabetes, risk of hip fracture amongst postmenopausal women, reductions in anxiety and depression, fatigue, risk of death, quality of life. And stress is that, even just a little increase in exercise, mostly walking. So he's not talking about triathlons or, really extreme exercise, how much of a difference that can make. So that's why I'm really looking forward to hearing from Alison and Peter and the great work that you've done in Blackburn with Darwen and the We Are Undefeatable campaign. So I'm going to hand over to Peter now.
Super. Thank you very much. That's a great introduction. And yeah, nice to be joining everyone today. I'm just going to share, we're going to go through a couple of slides today. And I guess the best way to say why we're doing that is because you'll then get a real feel for the We Are Undefeatable campaign, and in particular our imagery and content and assets that were brought to life in Blackburn with Darwen. So I'm going to dive straight in today because we could talk about this for hours on end, Alison and I. And I guess one thing is, please do ask us questions, but also if there's anything that you want to find out a little bit more about, we're always happy to answer any questions following today as well. So yeah, my name's Pete. I'm the activation manager for the We're Undefeatable campaign, which is a national movement supporting people with a range of long-term health conditions, which is backed by the Richmond group of charities, all of the charity partners that you can see on the bottom of the screen there. And it's also backed by Sport England through National Lottery funding. And the whole premise of the campaign is to provide inspiration through real life storytelling, through lived experiences of people living with long-term health conditions and how they find their way to move, as a way to make it feel more relatable, as a way to inspire other people who are living with long-term health conditions who are inactive to find their own way to move to, I guess, rather than being told by others and other professionals. And as a behaviour change campaign, we're insight-led to ensure that we resonate to a range of audiences, and the campaign utilises research and insights framed around the COM-B model of behaviour change to better understand the needs of our audience. And then that allows us to create key hooks within our messaging, and it really frames the ethos of what We Are Undefeatable is all about. And then we also add to that sort of body of research in this space to support our policy and influencing work across the Richmond group of charities too. So we've been working with partners and stakeholders and the wonderful Alison in Blackburn with Darwen to localise We Are Undefeatable for local systems, to utilise it and to create a movement for change at place. And the whole idea is that we are using our research and insights and understanding of the target audience through delivering an above the line mass marketing campaign over the last 6 years or so. But now we're looking to really look at how we can make this work at place to inspire others to get involved and to have a real local feel that will connect more to people from the place that they're living and the residents that they're with. Now, I'm not going to spend too long on this particular slide, but what I wanted to share from a public health perspective is where this is aligning to local strategy across Blackburn with Darwen. Because we didn't just pick Blackburn with Darwen as a drop in the ocean. There's a lot of reasons why Blackburn with Darwen was an area that, from a tackling health inequalities point of view, is something that we wanted to support and to target through this campaign to hopefully bridge some of the gaps in those inequalities, to support people living with one or multiple health conditions to be active across the borough. So the Eat Well Move More strategy, you can see there, the main theme that this whole We're Undefeatable campaign is connected in with as a key activity is that targeting interventions to tackle health inequalities. But this is a borough-wide strategy that covers lots of other core objectives as well around healthy foundations, active environments, the food environment, and supporting the workforce as well. And what you'll see is we've highlighted those in blue that we are connecting with through We're Undefeatable. It's been quite a learning for us just how much We're Undefeatable has been utilised across lots of different objectives. We can show people being active in the environment. All of it is trying to reduce and to target people who are experiencing widening health inequalities. And there's a big connection to the work around supporting the workforce, in particular with healthcare professionals through this campaign, but also then linked to other resources like moving medicine too. Again, we can go into the detail on that at another time, or if anyone wants to hear a little bit more about that alignment, but it's just always worth stressing at this stage that this is what was brought about through our work with Blackburn with Darwen Council's public health team that's then really helped us to come together to shape the delivery of this campaign. But the best way to get a real feel for the campaign is through one of our campaign stories. So I'm going to share Ralph's story with you next. And we've created a dedicated web page hosting 16 local resident stories to create a movement across Blackburn with Darwen, and that's hosted on the public health website. And the idea is it's really championing those real life stories of local people, focusing on the needs of the local population, spotlighting on local places and spaces, and also a key part of it is to then signpost to local physical activity opportunities across the borough as well. And within that, there's so much that the campaign is based on in terms of our background and research to make this feel more relatable. Things like condition cues, making the activities feel attainable, which Russell referred to earlier. We don't really want to be showing things that for someone who's completely inactive, living with multiple conditions, it needs to be something that they can achieve by getting out and moving more, rather than focusing on things like fitness and exercise. So what we're going to start with this time is actually sharing the campaign impact so far, and then Alison's going to go into a little bit more about the delivery of the campaign and the real ins and outs of how all of that come together. But what we wanted to share is just what we found in Blackburn with Darwen so far. So through all of the digital comms channels, this campaign we know has reached tens of thousands of residents in Blackburn with Darwen and has had substantial engagement and impressions across those channels that we utilised. I think it's really key to highlight that because we've really understood the audience of each ward, we've really looked into the demographic breakdown, and the public health data based in Blackburn with Darwen, it's really then helped us to target residents with appropriate and relevant content, which we know will resonate more with them. And we've got really strong completion rates, and the cost of the ads is low based on that. And by using the data, not only can you make your campaigns more successful, you can actually make it more cost effective as well. So I won't go through all of the different stats on the screen there, but that's just a little breakdown as to some of the stats, which is based only over a 4 or 5 month period. So obviously these have been increasing since the campaign spend finished around September, October last year. And then what we also wanted to do was not just think about the digital impact, but also the impact that it's having on residents in Blackburn with Darwen. So we had a public, and then we also had a stakeholder survey. And this is the impact that we found on residents. And a lot of this data aligns to what we find as a national campaign when we're tracking the impact of it, using our above the line spend across different channels. So we know that 1 in 2 residents recalled seeing the campaign, which again matches with what we find nationally. 1 in 4 accessed the campaign website and to then take a look at more of the stories off the back of seeing the campaign. Local residents found the campaign relatable, with 1 in 2 feeling inspired to take action as a result of seeing the campaign, the videos, all of the different assets and ways that they may have come across the campaign in Blackburn with Darwen. Almost half of people actually took action as a result of seeing the campaign as well. So those actions could be starting on their physical activity journey. It could be getting back into it or restarting, being active, but also less things directly linked to increasing physical activity levels, but maybe speaking to a family member or friend about being more active or gathering a little bit more information. So we know that it's driving that behaviour change for almost half of the people who are seeing it. And then in terms of the reaction to it, we know that 85% of people stated the campaign shows that people with health conditions can be active. And that's a huge part of what we're looking to do as We're Undefeatable, is to change the narrative that people living with one or multiple conditions can in fact be active and do it in a way that works for them. And 87% of people stated it shows how moving more can enable people to enjoy more things in life. And I think this is a huge part, again, of the campaign ethos, is that it's not just about the impact on a person's symptoms or the way that it's manifesting through their health condition. It's actually about how it can improve someone's social connectedness, how it can reduce feelings of isolation, all of those social impacts, as well as the sort of physical and mental health and well-being impacts as well. And then when we also wanted to find what our local partners and stakeholders who've really been behind and backed the campaign and were behind the storytellers and giving us the opportunity to showcase the stories and showcase their services across Blackburn with Darwen. And again, I won't go through them all, but we know that lots of local partners said that the campaign aligns and supports with local strategies and priorities and initiatives, which shows that we've kind of landed that well alongside that Eat Well, Move More strategy. Again, a much higher percentage recalled seeing the campaign across a range of channels in Blackburn with Darwen. Over 85% agreed that the campaign provides a platform to connect on an aligned physical activity message, which is great. That's exactly what we want to do. We want everyone to be singing off the same hymn sheet when supporting people living with long-term health conditions to be active, because we know through our insight and research over the last 6 years that this works. We know that people have said that the campaign is useful to support local organisations in reaching more people as well. So it's not just about inspiring it from a campaign perspective, it's also about how it can then impact on bringing people through the door in terms of signposting people to services. 55%, just over half, said it made them think differently about how to support people with long-term health conditions to be active, which is pretty huge, seeing as though this is mostly completed by council professionals or physical activity and sports sector professionals. So the campaign's even helping to change the narrative from a stakeholder perspective too. And we also know that almost 3/4 said that it reflects local demographics and needs, which is great. And that's the whole idea about localising a national campaign. And then the final bit before I hand over to Alison is just, we know it's also been trailblazing in Blackburn with Darwen. We've delivered many of these types of webinars to share this kind of learning. And I think it's then helped us reach all corners of the UK, whether that's been through today's session, Local Government Comms Academy. We held a whole webinar at the back end of January across the sport and physical activity sector for this too. It's been flagged at the NHS Confed Expo by the Director of Public Health for Blackburn with Darwen. We've got DCMS coming to visit, and Alison will be talking about this campaign with DCMS next week, which is fantastic, all around the sort of policy and influencing perspective of how this type of work can then influence what other places are doing, and for government to have sight of that is really impactful. It's been shared with lots of our other national partners, including our charity partners, as well as sort of key national stakeholders like the English Football League. And as I said, it's been discussed in Parliament already, but then Alison's going to be doing a little bit more with DCMS next week too. So I'm going to hand over to Alison now to talk a little bit more through the campaign delivery.
We delivered the campaign in lots of different ways, tried to use lots of different tactics and methods to reach different communities in Blackburn with Darwen, which are quite diverse. We've got pockets of quite affluent areas, we've got pockets of quite deprived areas, we've got segregation, we've got it's very diverse, all the different wards in Blackburn with Darwen. So we couldn't do a one size fits all. We had to tailor make our delivery specifically to each ward and using the appropriate storytellers. Next slide. Okay, so it started with a website which I've shared in the chat. Blackburn with Darwen Public Health Department have their own website, which is where all the stories are housed, all the 16 different storytellers. And if you click on one of these stories, you get the video, the 2-minute video, and you also get the text story, and you get signposted to where that person has received support. So Glyn does walking football at Blackburn Rovers, and at the bottom you can link to Blackburn Rovers Community Trust. You can also link to Age UK, you can also link to Alzheimer's Society, where you can access support if you are living with this condition. What's unique about Glyn's story is it's actually told through his carer, which is quite unique because that doesn't happen very often. So all the stories are shared on there, and the public health team at the time were looking at kind of search and how to improve traffic to their website. And it was an unintended consequence, but having the We Are Undefeatable stories on their website has increased search by over 2,000%, which is incredible. There's also a campaign pack on there, so if any of you would like to download any of the assets we've created for free, most of them are unbranded. They just say we are proudly supporting We Are Undefeatable on there. They haven't got the council crest or logo or any other partners. Please visit the campaign pack and go and download them, and the same with the videos as well. And that's been intentionally done because Sport England have funded this campaign, and we want to share the learning. We appreciate that other local authorities, physical activity providers and charities that support people with these long-term health conditions don't necessarily have the resource or capacity that we've been afforded over the past 18 months. So, okay, next slide. So out of home advertising, yeah, it's a behaviour change campaign. It can be difficult to measure the impact of out of home advertising, but what we found from the stakeholder interviews and the public surveys is actually it was really important to have this out of home advertising. We had 50 bus stops in the borough, 2 giant billboards, one in front of the town hall and one by a really busy crossing. And we had 6 totem screens in the railway and the bus stations. Blackburn with Darwen are quite unique in terms of they actually own most of their advertising assets. So the cost to us for this was a lot less than if we were paying a commercial entity, but it proved that the people who weren't our target audience actually saw this. So our target audience saw it mainly on social media and digital media, but those other people saw it as well. You know, everybody was, oh, I've seen it. You can't not see it. It's everywhere, and it's so colourful, and it it brightens everything up compared to other adverts out there. And our storytellers were going along taking selfies of themselves next to the bus stop and promoting it on their social media and things, as were the charities that were signposted to. So yeah, it was good use of our spend. Social media, we worked with an agency to coordinate and develop all the campaign assets, and they created a content plan for us. Again, Blackburn with Darwen has 3 different platforms. They have the main council social media sites, they have Blackburn with Darwen Leisure, and they also have Blackburn with Darwen Refresh, which is the leisure arm as well. So we developed content for those 3 different platforms, and then the individual channels across there as well. So not every story was seen in the same place at the same time on the same channels. It was really mixed up, so people were seeing different messages, different colours, different images of how you can be active at lots of different times. Again, in that campaign pack, the social media content plan is in there, and anyone can use them. What I did learn a lot was by listening to some of our storytellers, and one lady in particular, Sima. When we created some of the videos at first and some of the messaging, she said, "Alison, can you recreate this for me, please?" She said, because the people I work with, the ladies in the Southeast Asian community that the charity I operate with support, don't actually use Facebook. They don't use they don't watch longer form video content. From a privacy point of view, they're more inclined to use WhatsApp or TikTok or Instagram Reels. So we actually recreated some of the content to suit the channels that those audiences were using, which I wasn't aware of before this campaign, I'll be completely honest. Because of the feedback we got from Sima as well, we also created 1-by-1 videos for each storyteller to use more on social. Okay. We featured in printed publications. The Lancashire Telegraph, our local newspaper, were very supportive, and the journalist went out and wrote much longer articles than what was the content on the story pages, went a lot more into depth about the conditions, was keen to chat to the individual storytellers if they kind of gave permission to do that. Yeah, they were really fantastic, supportive. The One Voice magazine. The One Voice is a charity in Blackburn, and they produce a quarterly magazine that's distributed to 14,000 households, largely the Southeast Asian community. And we featured 3 different stories in the summer and the autumn magazines. Now, what I've learned a lot of is to listen to these different community groups who support the people that we're trying to reach, because I had an idea of who should be featured in these magazines and who the Lancashire Telegraph might want to feature, but actually it was quite different from who they thought was best. The One Voice magazine, for example, said, "Alison, in our community at the moment, there's an increasing number of younger people having strokes. Please can we feature Zoe's story?" It's like, yeah, I wouldn't have known that. So really listen to those different charities and community groups in your districts. Posters. When we first set doing this campaign, we planned to be digital only. That changed quite quickly, to be fair. We printed 8 of the 16 storytellers on posters, and we sent these to all the libraries, family hubs, leisure centres and council offices. And I actually went and hand delivered them to the GP surgeries in Blackburn with Darwen. What I also learned from the GP surgeries in Blackburn with Darwen, we made our 2-minute videos thinking that they will put them up on their TV screens in the waiting areas and they'd be shown and such like. Well, actually only a fraction of those TV screens were actually used in that way. So some of our videos weren't used as much as we would have liked or intended them to be at the beginning, but all the posters were put up and they were visible and they were colourful and stood out from a lot of the posters on the wall. So yeah, they were really well used in that respect. Shared by our partners, to be sustainable, this campaign really needed to be owned by the organisations in Blackburn with Darwen. It's not a council owned campaign. We wanted it to be owned by all the different organisations that support people living with long-term health conditions, whether they're physical activity providers or not. Hence why we've not branded up a lot of the assets, because we want anyone to be able to use them. There were some partners that really utilised the assets fantastically well. The 180 project, for example, have used Michelle's asset there to raise awareness of their service. SAS Rights have used the assets we've created to apply for grant funding to continue their service and expand it. Blackburn Rovers have been absolutely incredible. What was interesting was Glyn goes to Blackburn Rovers Community Trust for walking football, and they'd featured Glyn's story on Dementia Friends Awareness Day a few years ago, and they were keen to get a different perspective as well. And they said, Alison, have you got anyone who's got a link to Blackburn Rovers in any way other than Glyn, who utilises our services? I said, well, yeah, we've got Bob. I know he's a lifelong football fan and season ticket holder. And they said, would you mind if we kind of asked Bob if he could come along and we could do a shot with the stadium in the background? It's not at all. So I facilitated that, and Bob went along and did another interview. And Blackburn Rovers shot a 7-minute video that told his story in much more depth than we did in our 2-minute video, and shared it on their website and across all their channels. Now, inevitably, more people saw Bob's video because it was shared by Rovers and it had the stadium in the background than saw our video. So, you know, really powerful involvement of partners. And, you know, football, the beautiful game, the EFL have shared Glyn's video in a collab post that's reached tens of thousands of people nationwide. So one of my tips of advice is to really think about the partners who can really help you amplify your message, and find out what their success factors are early on, and go with that. Okay, I'll just hand over to Pete now, who facilitated that collaboration with the English Football League.
Yeah, that's a really good way to share that. It's kind of a lot of what you've heard so far is how we've shaped it based on local need, but then I guess our role as the national campaign has been then to try and amplify this across our partner channels and also our key stakeholders, as I mentioned at the start. So on the right hand side, you can see some more of our charity partner engagement. We've had some stories with Breast Cancer Now. Bob's story was shared by British Heart Foundation. Dilwara's story was shared by our sister campaign, This Girl Can, another Sport England campaign that you might be aware of as part of their Let's Get Out There campaign, which is all about encouraging people to walk along, get active outdoors, but in Dilwara's story was along the canal. Dillis's story has been shared multiple times by Mind through their physical activity newsletter. And Alison also produced a blog for Sport England revolving around Ralph's story that you've seen earlier. And yeah, in terms of Glyn's story that Alison mentioned earlier, on the left-hand side, you'll just see some of the stats and what it meant for us by sharing Glyn's story as a collaborative post. It made sure that we had both our local partners in there from Blackburn Rovers, from Blackburn with Darwen Council, but then also we shared it and hosted the collaborative post across our national We Are Undefeatable channels, linked with English Football League in the community, Alzheimer's Society. And by having that collective reach, it then allowed us to reach so many more accounts and actually non-followers to We Are Undefeatable than what we've done before. So it's a really good example of how it can then be amplified across those different partners that we're connected with at a national level too. Alison? I think you're on mute.
Sorry. One thing we've tried to do our best on is make sure the content is accessible and inclusive, because this campaign is to help tackle inequalities, and those people with inequalities are more likely to be excluded from some of our communications if we just go through the normal channels and normal routes. door launch event that we held in June last year, a lady from the Dutton village, Northwest, approached me and said, Alison, I think your videos are fantastic, but is there any chance we can make them accessible to the deaf community? And I said, oh, they've all got subtitles on. She went, no, but BSL is very different from written English. People who only understand BSL won't understand the subtitles. So it's been a massive learning curve for me, and consequently, all the videos we created since that launch event have got subtitles on. Sorry, not subtitles, got BSL translation on, sorry. And those BSL translated videos have then been shared by the Deaf Village, who have got 11,000 followers on their Facebook groups. And you know, we've ultimately reached an audience these videos wouldn't have reached beforehand. And it's not that difficult or costly really to put sign language on the bottom. We've also got 2 storytellers who are visually impaired. One of them is Ralph, one of them is Sima. Both their videos have been audio transcribed. Because we've audio transcribed their videos, the RNIB have enabled us access to their closed Facebook group, Connect Northwest, and those videos have been shared across those platforms. Following research and chatting to some of our different communities, we didn't do translation into other languages on the videos because there's so many dialects that, you know, what works for one part of the community might not work for another. We didn't go with AI translation either because we were advised that some of it wouldn't be understood. But the public health website has the ability to translate in 13 different languages. So accessibility has been really important to us. And we're currently in the process of having all the stories in a read easy format so that people with low literacy levels and learning disabilities can understand them.
Thanks, Alison. And yeah, we're going to whiz through the next couple of bits because there's some great questions in the chat already, ones that we'll be able to come back to you on. And actually, the one from Sasha is something I'm going to get to shortly in terms of the use of the assets, because we're going to also share about how you can get involved with the Blackburn with Darwen campaign and the assets there, but also the national assets and resources that We Are Undefeatable has too. But really, just quickly, we'll whiz through some of the key learnings so far. Alison, do you want to whiz through these?
Sorry. Okay, so what we learned, and some of these I've touched on, but if you are looking to do a similar campaign but don't have the resource and capacity that we've had to cover all the conditions by the Richmond group of charities, I'd focus on what conditions are more prevalent in your community. So we initially tried to cover all the different charities. If I was doing this again on a much smaller budget just for Blackburn with Darwen, I'd be looking at heart conditions, I'd be looking at diabetes, I'd be looking at mental health and such like, and you'd be able to find that information out from your public health team. Think strategically about who you want to partner with, which organisations work with people that are your target audience, and involve them from the start. So just like I mentioned, Blackburn Rovers were absolutely amazing in amplifying our message, as have many others. Take the time to meet, listen and learn from others. So One Voice Charity in Blackburn have been amazing in terms of identifying some storytellers, featuring our stories in their publications, sharing it on social media, but also the chief executive has a background in advertising, so he knew exactly which bus stops I needed to use in Blackburn with Darwen over others, which saved me lots of time and maximised the success of the campaign. Tailor the content to the channels your audience use, not the ones that are necessarily easy to boost or the council use, because we found that ours weren't necessarily reaching the right audiences at the beginning, and since we tailored the content. Videos, a big cost element of our budget was to create the 2-minute videos, and we found that we couldn't share them in as many places as we wanted. If I was doing it all over again, I wouldn't create the 2-minute videos. I'd create the 1-minute videos, but I'd also think I wouldn't create a video for every single storyteller. I'd create ones for the people who naturally kind of are more comfortable in front of a camera and willing to share their story on a video. So I'd be a bit more selective. Print is still so powerful, particularly in, when we're thinking about digital exclusion and digital inclusion. Print reaches those people who don't necessarily have access to Wi-Fi, to digital devices, who don't perhaps want to go on them as well. Print reaches them. Being unbranded ultimately increased the reach of this campaign, increased the shareability of the assets. It wasn't owned by the council. People felt that they could share it. It was theirs as well. And don't dismiss out-of-home advertising. Look at ways that you can do it for lower cost, using independent advertising screens. Chat to different people. But yeah, it works a treat for us.
Alison, I'm really sorry to do this, but I'm going to have to hurry you along a little bit because we're going to run out of time. If that's okay. So you've got a few more slides to cover. Thank you.
Okay. Yeah, so we used public health data to really shape the campaign, to identify the priority audiences. The different stories didn't all appear on bus stops in the same wards or on the big screens in the same places. That's a different webinar that's available on the Together and Active Future website if you want to watch it, and our YouTube channel. We decided not to cover that today because of time allowed. It takes time to develop this kind of campaign. It takes trust. At first, not that many people knew about We Are Undefeatable in Blackburn with Darwen. So when we asked them to be part of this campaign and tell their story, there was a little bit, oh, what is it? But the ball has got rolling now, and everybody knows what We Are Undefeatable in Blackburn with Darwen is, and people want to be part of it. And collaboration. We couldn't have had the success of this campaign without collaborating with multiple stakeholders and partners in the borough. We've undertaken evaluation, and we're hoping a report will be available for everyone to view in mid-June.
Super. I'm going to really whiz through these last little bits about then how you can get involved. So the We Are Undefeatable national website has a whole host of inspiration for people living with long-term health conditions. You can access that. I can share a link to that to have a little look around for yourselves. This is the main campaign website is entirely aimed at people living with long-term health conditions to inspire them to get started on their physical activity journey. And there's lots of different information and advice and workouts and routines that are hosted on there. But at the same time, we also have a campaign hub. And Sasha, this comes back to your question in the chat. Within the campaign hub, all of our assets, resources from the national campaign are hosted on this campaign hub. So you can scan the QR code, or in the top right corner of the We Are Undefeatable website, you can access that. There's lots of comms and marketing guidance. And I think your question, Sasha, was about, do we need sign off? No, you can utilize the Blackburn with Darwen assets, our national assets, in ways that you would like. All we would ask is that it's in the feel and the theme of We're Undefeatable, and that sort of ethos to make sure that we're utilizing it in the right way. I was in a leisure centre not too long ago and seeing a eat, sleep, train, repeat across a lycra-clad lady, which may work for some people, but unfortunately for people living with long-term health conditions, it's less likely to connect. And that's a really quick example of, I guess, there's lots of messaging, lots of information about the brand in there, so you can take a little look and just ensure that it aligns with that, with any comms. But absolutely any usage that you want to utilize the assets and the imagery and the videos, then please feel free to do that. And most importantly, tag us in it. We're Undefeatable, or hashtag We're Undefeatable, so we can amplify it too and share your successes as well. And just on a very quick note, we've just released a new asset template that will allow people to localize and create their own We Are Undefeatable assets. So this is a PowerPoint resource that you can basically add your own imagery to. You can add your own stories to from any services or local programs. So the one on the right hand side is one that I made up, and I'm not a marketer by trade, but this is John's story and his imagery, and I just made up that this is signposting to a physical activity referral scheme in Sheffield, alongside one of our partners we've been working with, Freedom Leisure. So there's ones where you can signpost to local activities in the same look and feel as We're Undefeatable, but utilise and change the copy and the assets and the imagery. But then also there's a story one as well, where you can share your own We're Undefeatable stories. And that's a real key bit, because over both campaigns, we've probably got 40 stories, but there's hundreds and thousands out there of more people living with long-term health conditions being active. So that's it. If you want to find out a little bit more about We're Undefeatable in Blackburn with Darwen, that's a QR code there. Or if you're really interested in localising the campaign, then feel free to get in touch and I can talk through some of that. I guess back to your question, Sasha, if you are creating your own assets or you are thinking about connecting with the campaign and you're a little bit unsure, feel free to drop me an email and I'm happy to help in the first instance. And yeah, that's it from us. So thank you very much.
Thank you, Peter and Alison. That's really interesting. There's a couple of questions that we'll come to in a moment, but first of all, I'd like to bring John Paul in for reflections and thoughts on that, and also to share some examples of good kind of physical activity promotion. What you've seen that's worked. Yeah, sorry, you've frozen on my screen.
Oh,
that's better.
Here.
Yeah, you're right.
Good. I'm really well, thank you. Yes, and thank you, Alison and Peter, for not just sharing that campaign, but for that work. There are so many brilliant facets to what you've just done. I love the use of stories. We know stories are at least twice as effective in connecting with people. The fact that you've built it to share, I wish many more organisations did that. We'll be sharing it with all our partners, the people we work with, and we'll promise as well to feed back the data to you guys in terms of what works and how that works, so it creates more outcomes for the campaign. I love the collaboration in there, collaboration sort of built in. But what really stood out for me, Alison, was that community insight, speaking to people and adapting the campaign for accessibility, but also for sort of cultural humility around it. I just thought it was fantastic. And the use of public sector owned assets. I prepared this before seeing your presentation, and I just need to take you through a few things really, really quickly. But we always talk about everything you do should be, inclusive. It should always be saving. And if there's no data, there's no comms. The point around 90% of, reaching that audience and using a mixture of human and using stories is just absolute gold. I think as well, looking at the impact of that, using the media estate, the council-owned media estate to save money was just brilliant there. Because unfortunately, many campaigns suffer investment in channels that don't necessarily drive the kind of response that you need. And then being able to show at the end that evaluation, it makes it really investable and repeatable. If anyone else is looking at running these sorts of activities, there are so many sources of free insight and free, search, social, audience data and things that you can put out to people. I think as well, like the user experience and everything we put together worked so well. Also, the use of data to model using platform availability and ONS stats, the audiences was absolutely brilliant. The use of the physical and probably as well the digital estate is something that we're really recommending people do. We're finding it generates so much in terms of impact, additional A/B testing for free, enabling the campaign to be always on and getting more interaction from people. The fact that it's free to use is absolutely gold for things like this, because sometimes you get a campaign that just runs for a little bit and it's not then able to, its impact stops. So that estate is key to being able to keep these campaigns always on and keep those outcomes coming through. Yeah, there were loads of brilliant things in there, and the ability to then target specific audiences, lower income audiences who are maybe accessing benefits content and so on. I think it's golden. Your point as well around print and particularly direct mail really working. We think it's really important to do that for almost everything, to map where the audiences are and then deliver print versions as well of the campaign, with also non-digital outcomes, non-digital user experiences, so people can engage. Improving landing pages so that people can sign up and take action, either on things like Jotform or also in-platform social media lead gen is really, really important. That means that people can take an action, and also that action can be measurable. We've also partnered with an organisation called Space to Co, where when people interact with these campaigns, we can measure them booking tennis courts, swimming lessons, a whole range of different physical activities. And this platform is free to use for the public sector. So we're partnering so you can actually see people taking action directly from digital campaigns and so on. You're probably aware of the communications funnel, but I think having those owned channels and then specific digital channels, use of search, use of remarketing, and then a real simple user experience enables you then to optimize. So to make sure that you get more impact from your campaign and you reduce that cost per outcome. It's very hard often to measure these campaigns, but we really recommend using Looker Studio to get all CSVs from all the platforms and all the data, bring it together so you can actually show stakeholders the correlation between your communications activity and the outcomes from the campaign, but also then to optimize and cut and shift spend from things that don't work as well to things that really, really do. So again, what you've done is fantastic. What we think as well is really important is that you partner those leisure operators who may be already promoting fitness classes, even kids parties and things like that, and junior sports and so on, and showing the impact of your campaign on their campaign. That sort of collaboration, working together, we think is a huge opportunity for improving things. And so over time, you can reduce that cost per physical activity and move away from that kind of slightly sort of spray and pray approach to a more always on engine that drives increases in physical activity, so that you can then start to prove that every pound invested in communications leads to multiple pounds saved in terms of health interventions, in terms of improved lives, in terms of reductions in care packages for people. And I think this approach with brilliant stories, brilliant collaboration will enable us to learn over time. And these are campaigns that we're running in other parts of the country where we can see the cost per booking and therefore help them invest in keeping those campaigns going. So I rushed through that deliberately just because of time, but absolutely brilliant job, everybody. And it's brilliant as well that we can take that campaign and use it in lots of different other locations. I apologise for the background noise. I'm in a very echoey hall, but I hope most of that got across. I'll pass back to you, Russell.
Thanks, John Paul. There's a couple more questions in the chat. So one from Glenn, which says, at any point there will be people who want to become physically active. What evidence is there that this campaign got more people physically active than would have become active anyway? It's a good question. It's difficult to measure, but any response, Alison or Peter?
Yeah, I'll answer that one. I'm quite happy to answer that. So yeah, with any behaviour change campaign, there's always difficulties in measuring the full extent and impact. But there's some of the case studies where we know it's made an absolute difference. So from the Deaf Village's involvement, for example, because they shared the campaign, the people in the deaf community went back to the charity and said, well, we should be a little bit more active. And as a result, they've started walking groups. They've started going to the Whittaker Cycle Centre every couple of weeks to do a cycling activity. They've installed an outdoor gym, and they're working with one of our providers to look at having a gym that's where they have a signer to show how they use the equipment, etc. Sima, the blind baseballer, she's lived in Blackburn all her life. She had sight until 12 years old, but then it deteriorated and now she's registered blind. She used to love cycling with her brothers when she was young, but she hasn't been able to do that since. She didn't know that the Whitton Activity Hub had adapted bikes and they had tandem bikes. So following this campaign, she cycled for the first time in 30 years. But right at the beginning, there was a few people within the council, some elected members who said, oh, how's this funded? But as soon as they realised that this funding was from Sport England through Together an Active Future, and that I've been working on this at no cost to the council, as has Peter, there's been no cost there. They were very, very supportive and really got behind it. As I think as soon as they some people realised that this money wasn't council money, everybody's been absolutely behind it, really. But we mitigated that by having lots of conversations internally before the event went public, and we also held a launch event as well where we kind of got that message across again. I would say the groups and the organisations within the borough who have been involved in this campaign have really benefited from it, because they've then had assets that they can use to raise awareness of their own services. So yeah, as far as I'm aware, there's been no negativity at all.
Yeah, and just on the latter part of that question, it's something we see quite a lot with the national campaign, is that sometimes when we post certain campaign assets, certain videos, certain campaigns that we're launching, people will reply and talk more about their own situation, which could be that they're struggling with their health or through the situation they're in, and it's about how we respond to that, but then also how the campaign, what you'll notice within it is we talk about sort of the light and the shade, and living with a long-term health condition isn't all positivity and light, and it's certainly a non-linear journey. And I think one of the things that we've learned from our target audience is actually we want to showcase those challenges that people are facing, because that will make it more relatable. So yeah, just again, something that we found from the national campaign with that.
There's also a question in the chat about how did we tailor the content for WhatsApp? So basically we went back to our video production company and said, okay, can you make really short clips of the video that kind of are able to be shared really easily on WhatsApp? And it wasn't us or the council who posted on the WhatsApp channels, it was the individuals, the storytellers themselves and the organisations that were involved in the stories. So yeah, it was more user-led than us.
That's great. I'm gonna wrap us up because we're at the end of time. But I'd just like to say a massive thank you to Alison and Peter for sharing your case study, but also for, as JP alluded to, the ethos of the campaign and the keenness to share all your assets. There's a lot of learning and things that people can literally take and apply in their local areas there. I would also ask, when you complete and publish your evaluation, we'd love to share the link to that if it's published online with this group, if you're happy with that. But yeah, thank you so much, Alison and Peter, and also John Paul, for your contribution. Yeah, thank you everyone for joining. We'll see you next time.